Hi, and thank you so much for tuning in. My name is Rute, and I'm a general practitioner and medical doctor. I decided to do this video because I know that there are a lot of women who ask the question, how do I know if I am fertile? And I'm going to be honest and say that at the end of this video, I don't think that you're going to get the answer that you want, but I hope that it will make it more clear why the answer to that question is not always straightforward. I remember before becoming a doctor, I asked this question, and I remember how I felt. I felt disappointed that I didn't get the answer I was hoping for, because I thought, why can't you just do a blood test to check? I thought, why can't you just do, is there no scan that you can check to see? Why can't you ask me questions? And most people say, as long as you're having a period, then you're fertile. But I'm like, I want to know, does that mean I'm fertile? Now that I'm a doctor, I understand why it is not so clear cut. And I hope that this will help someone out there who is asking the same question. I'm going to answer this more from a woman's perspective, more as if it's a woman asking the question, Doctor, how do I know if I'm fertile, or how do I know if I can get pregnant? I will use an illustration just to explain why it can be difficult to give you a straightforward answer. If you think about a puzzle, there are different pieces of the puzzle that need to fit together to be able to make a picture. So that's quite similar in pregnancy. There are different pieces of the puzzle that need to fit together to make a pregnancy. Some of those pieces come from the woman, and some of those pieces come from the man. So from the woman, for example, some of the pieces that you would need are hormones to make sure that you ovulate so the egg comes out. And these hormones need to be at certain levels at certain times. We need to make sure that you have the eggs so that there are eggs that can be released when you ovulate. We want to make sure that there are tubes where the eggs can travel down to, and that you have a uterus which can help the growth of the baby. And on the other side, from the male part, you want to make sure that there's sperm. You want to make sure that this sperm can get to the egg. So there are different elements that are required to get pregnant. And these are just some of the examples that I've given you. So back to the pieces of the puzzle. There are certain elements of these pieces of the puzzle that we can do investigations for, which is why when somebody asks the question, is there a blood test that I can do to check if I am fertile? Yes, there are some blood tests that you can do, but those are not going to tell us for definite whether you can get pregnant or not. They'll give us a small picture of that puzzle to say, okay, we've checked your hormones. The hormones are where we expect them to be at a particular time of your cycle, so we are happy that you can ovulate. Similarly, there's another blood test called the AMH, which can help us to check your ovarian reserve. This gives us an idea of how many eggs are left in the ovary. As women grow older, the amount of eggs that they have in the ovary reduces. So this is quite a good indicator to see if there is a good reserve, there's a good amount of eggs in the ovary, and it's really useful in people who go on to have IVF. Now that's just, an example of some of the blood tests. And then there's, looking at your cycle. Are you having a regular cycle, which might give us an idea that you are ovulating? The other question that people ask is, can I get a scan to check my fertility? So we can do a scan. So we can do an ultrasound scan, but that again will only give us information on one piece of the puzzle. Now, I've explained all of that just to give you an idea of why it is difficult for us to give you a straightforward answer, but not for you to lose hope. The reason I say that is because the majority of people who are trying to get pregnant will get pregnant. Approximately 84% of couples, that is male and female, who have sexual intercourse regularly, so about 2 to 3 times a week, will get pregnant within the first year. And then that number will increase to 92% after 2 years. So 92% of couples, male and female, who are having regular sexual intercourse will get pregnant in 2 years. And after 3 years, or within 3 years, that will increase to about 93, 94. Now, those statistics are based on women who are less than 40 years old. So what about the remainder, let's say roughly 10% of couples who are struggling to conceive, who are struggling to get pregnant? That 10%, that might be due to multiple factors. And it's important to remember that if you've been trying to get pregnant and you don't get pregnant, that does not define you as being infertile. We will use the word infertility in situations where people have been trying to get pregnant, they've gone to the doctors, they've been investigated, and if they've found something that needs treating, that's been treated, and they're still struggling to get pregnant, that's when we can start to look at the term infertility. But just because you've been trying to get pregnant for a year, 2 years, 3 years, that does not mean that you are infertile. So what are the main causes of difficulties conceiving, so difficulties getting pregnant? I want you to pay close attention to this. And remember, I said at the beginning that this video was mainly aimed at women asking that question. The main singular factor that causes difficulties in conceiving is problems relating to the male factor. 30% of couples struggling to conceive, the cause of that is related to male factors. Roughly 25% is due to ovulation failure, so where the woman is not ovulating. 20% is due to tubal damage. Roughly 10% is what we call uterine disorders, so things like fibroids. So overall, you do get about 50% of that being due to problems that might be related to the woman, but 30% is problems related to the male factors. The other 15 to 20% is unidentifiable factors. So these are things that we cannot find a cause. You've been investigated, doctors have investigated the male and the female, and everything from our investigations is what we would want it to be for you to be able to conceive, but conception is not happening. It's also been found that in about 40% of couples, the reason why they're having difficulties conceiving is related to both the male as well as the female. Because the majority of couples will get pregnant within the first year of trying to conceive, we don't recommend doing investigations before. So there's no need for you to book an appointment to do a blood test, to check your hormones, just to make sure that everything's okay. There's no need for you to book an appointment to have ultrasound scan, just to make sure everything's okay. But we do recommend that if you're going to start trying to conceive, that you do book an appointment. This is more for us to have a chat with you, make sure that you're taking folic acid and at the right dose, making sure that, if you are on medication for other medical conditions, that those are safe in pregnancy, looking at things like smoking. And it's in this time as well that we'll be able to say, okay, if you've been trying for 6 months and, you haven't become pregnant, give us a call. Or based on that conversation that we've had, if you've been trying for over a year, then give us a call. And I do know that, there are different areas in England where the cutoff point for referral is different. So some areas might be a year, but some areas might be more than a year. So if you give us a ring before you start trying, if you know that this is something that you're going to try to do, then at least that will help you have in mind when it's time to call the doctor. Thank you so much for watching this video. I do hope you found it useful. Until next time,